Welcome back to Turning Hard Times into Good Times. I'm your host, Jay Taylor, and I'm really glad to have with me my friend and partner, Chen Lin. Welcome, Chen. Thanks for joining me again.
Thank you, Jay. Appreciate it.
You know, both of your favorite bio-pharmaceutical stocks have become kind of quiet lately. Very volatile at times. You can really interesting things to watch, but they've sort of calmed down a bit now. And they're actually down a lot from their highs. Yet, if I understand you're really excited about both of them. So let me ask you to update my listeners on both of them, starting with Sarepta Therapeutics trading at around $12.70 earlier today. I'm looking on the screen now. Sarepta, $12.70 right now. In fact, it's a company with an apparent successful life-saving drug for young boys who have a form of muscular dystrophy. And I see that the FDA is actually getting in the way, it seems to me, in terms of allowing this drug to be approved. You know, there's really, these boys have no choice. There's really nothing to save them, essentially, and yet this drug looks so promising. And when the FDA has not really gone all out to support it, the stock has really taken quite a hit. But you see this as an opportunity, and in fact, you're telling your subscribers that you're loading up on Sarepta. Tell us why you remain so optimistic about Sarepta. Do you think that finally the FDA is going to have to allow this drug to be approved, or what is your thinking here, Chen?
Yeah, thanks, Jay. Good question. Well, Sarepta was trading at $40 just a month ago, right? At that time, I told my subscribers to sell, right? To unload, because I saw the potential FDA may be very negative on that, which they did. I mean, I've been trading this for so many years. I kind of know what the FDA is thinking. I got it a single digit, by the way. The latest round of FDA is that the FDA division has very negative. They wrote a very negative briefing document. But if you read through the line, you know, this whole story of Sarepta, why it's so volatile, why it's so up and down, there's one party very much against it. That's a division of the FDA, right? The Fokker says that he's a guy, he's an eye doctor, but he hates trial without being the placebo-controlled trial. He hates that. He hates his control. That's him. He's been like that for the past many years. You can see his speeches he made. It was like that. Okay, so every time the division says something negative, stock went down. I mean, every time the patients are working and then they talk to the FDA management told division, shut up or something, quiet down. I mean, then the stock went up. It has been like that for many years in the past. I was able just to ride that, right? Just buy low, sell high. I mean,
okay, Chen, let me just stop you for a minute. This is a question in my own mind here. This fellow at the FDA wants to see a placebo-controlled group, right? He wants to see one group getting the medication and one group not. Is that something that wasn't being done with Sarepta's trials?
Oh, it's done only partially because you gave placebo is giving the child that sentence. You see what I'm saying? So they only gave them for short period. If I remember correctly, first 12 weeks or 24 weeks. I mean, they give placebo. Okay. And then they gave everybody the medication to, you don't want to see the child dying, right? You don't want, I mean, he doesn't like it. I mean, that's sure. Him. But if he got his own way, they would do another phase 3 trial, a very large phase 3 trial, and then takes another 3-4 years to.
So more boys will die in the meantime.
Yeah, I know. He doesn't care, but it doesn't matter. But the problem right now is fact matter of people's life. Yes. Right? So there's a large protest, which I help a lot. I wrote to my senator, I wrote to my congressman. You see that congressman letter he wrote back to me.
Yes.
He already acknowledged that he wrote the letter, for me and constituency because the election year, and other people he wrote to the FDA about that. So there's a strong push. But the reason is there's a new law, right, called PDUFA. PDUFA require FDA to consider this situation, to give conditional approval, and then evaluate the drug. That's the whole point. And then this guy Focus and his division, he didn't care. He doesn't want to follow the new law. So that's basically the storyline. So bottom line, this is the bottom line, right? So since that come, there has been very strong protests. The AdCom got delayed because of the winter storm. And FDA already missed their first promise, which is to schedule an AdCom within 1 month of the original AdCom. The consequence of that, which I believe is FDA management talked to Farkas and his team, say, hey, you have to update your briefing document to correct all your mistakes. So I think there will be a new document will come out, and then hopefully will be less negative, and then we have a shot. But market doesn't see it. You see the $40 stock drove all the way down to 10, 11, which I tell my subscriber to buy, back up, load up the truck, right? I mean, now it's like a 1270. I mean, it's up a little bit, but I think when we get closer to AdCom, it could go much higher.
Yeah, we should mention that the efficacy on the trials so far, although somewhat limited compared to what the FDA would like, has been very positive, hasn't it, Chen? And also, the side effects very negligible.
Exactly. There are no side effect, and then it seems working very well. Only 12 patients, though, but it works, right? I mean, the patient, I mean, they were like 14-year-old, 15-year-old kids are working. I mean, all
right, Chen. So this is definitely one of your top picks, Sarepta Therapeutics at this stage. It's one that you've put you're overweighted in your own portfolio. I think that's fair to say, probably, right?
Yes, exactly.
Okay, so now Sorrento Therapeutics, and this is a company that has really a very deep portfolio of very promising anti-cancer drugs that should represent a huge improvement over current chemotherapy approaches to treating cancer. Can you provide just really, really quickly, perhaps, an overview? What is the technology what does this technology do, and why is it better than current chemotherapy technologies that are being used to fight cancer?
Yeah, recently there's a breakthrough, right? It's called Karti. So basically using your own T cell to cure the cancer. There's so many articles there. The kids are dying. But then, Emily White, if you Google her, you know, she was dying, suppose has a few months life, and then they put the Karti on her. She survived, and she's 4 or 5 years later, she's still living like a normal kid. So then there's no cancer trace, any trace of cancer in her body at all. So this is a breakthrough in cancer therapy. And there's also different variations, Sorrento is doing one of those. I think they're treating the liver cancer, as it seems to be, late stage and doing extremely well. Their patient will live for a few years already. There also another technology called car tank. But the problem, the thing is for biotech, same as mining company, they need to keep raising money, and then dilute existing shareholder, right? So Sorrento has come to this stage. They have phase 3, they have phase 2, then they have a preclinical, they have a very strong pipeline. They have $50 million in cash, and then another about almost $50 million in security. So they have the cash and security is close to $100 million as of last quarter, and the market cap is only about $200 million, right? So the value of all the rest is almost nothing in biotech world. And so people think they're going to raise money, but the management told me no, they're not. They in talk to the major farmers, so hopefully they will sponsor them their research going forward. So this is clearly the market misperception. I think it worked in my favor. I always like those kind of situations, and I invest in that, and it potentially can go up a lot.
Yeah, so I think I saw you wrote recently that their burn rate is something like $10 million a quarter. So that would mean that they have enough money in the till now to last for a while. And then there might be some potential, I suppose. Might there be a larger pharmaceutical out there potentially that could come in and maybe want to do a deal with them? Is that a possibility, Chen?
Yeah, that's the management that are working on right now. So
okay.
That's a key catalyst for the company.
All right. So is it safe to say this might be your second most or one of your top picks? I guess Sorrento and
both of them are my top pick. I mean, both are both are my
overweight.
top.
You're overweight in both of those. All right.
Yes,
just with a minute left now, I know you have some very strong feelings. You and I learned to know each other because of our mutual interest in gold. And what's this with you applauding Goldman Sachs that's saying that gold's going down to 1,000?
Oh no, I wasn't. I was just pleased. I was thankful to Goldman because they try to drive down the gold. For me, I like to buy gold in around the summer, right? In the past few years, every year coming at summer and fall, I buy gold miner because that's usually the lowest part of the season, and I was able to survive and make money for me and my subscribers in the past few years in it's a bear market, brutal bear market of gold. So my point is right now is Chinese New Year. It's typical peak of the gold in seasonal chart. So if they go down a little bit, allow me to buy gold, at a reasonable price, even if not lower. Plus, Sarepta supposedly they're going to have a outcome in a month or two. I mean, so these things can. Sorrento have a few months, have a lot of catalysts. So hopefully, I have a success on those biotech. As you said, I'm ready to buy gold miners. I'm looking in my outlook. I was looking for 2017 as a bottom of gold, and then plus and minus a year. So could be this year, could be next year, could be the year after. But I'm looking very closely at gold miners.
All right. Well, you're always interesting to keep up with what you're doing, Chen. I want to thank you again for sharing your time with us and your thoughts as well. And folks, go to miningstocks.com to sign up for Chen's letter. miningstocks.com. You won't be sorry that you did. I think it's safe to say that, at least if you really keep on top of what Chen and where he's focused. That's what's really important to do. So thanks again, Chen, for being with us, and we'll look to do it again sometime very soon.
Thank you, Jane.